So we're talking about how we care for kids using the Erickson stages. So I know Erickson is something we memorize for NCLEX. We memorize it. I've re-memorized it for 3 certification exams so far. But Erickson really guides how we care for children as pediatric nurses. So I'm just going to kind of go over them a little bit with some helpful tips of different age groups as you begin a career of caring for children. So the first one is infancy, which is trust versus mistrust. So the idea of trust versus mistrust is that a baby trusts you to meet their needs. So when they cry, they expect that they'll be picked up or fed, that we'll figure out what's wrong. They're completely dependent on you. Over time, they'll learn that other adults, not just parents, can be trustworthy as well. And when a baby is neglected or their needs aren't met, they develop mistrust. So you'll see kids that aren't interacted well with by their parents. They arch away from you. They don't make eye contact with you. They feel kind of stiff. Sometimes that's the mistrust that's developed during this stage. So trust versus mistrust. Being responsive to babies and caring for them, picking them up when they cry, feeding, talking to them, singing to them. So this is the fun part of peds nursing. So developing that rapport, smiling, making faces at babies. I play a lot of peekaboo. I play a lot of rhythm games while I'm trying to distract babies while I'm doing a blood pressure. I'll do a lot of snap, snap, clap, clap, just to give them something to do while I'm weighing them or doing a blood pressure. Talk to them, sing to them, make funny faces at them. Babies love that. And also really work on how the rapport that we have with parents. So parents expect too that they need to be able to trust you as part of their team and that they need your respect and your trust as part of the baby's team. So really taking the time to get to know the parents and to help them as they help their child will help you a lot as you start caring for babies. So toddlers is all about autonomy versus shame and doubt. The toddlers want to know how to do things for themselves. I do it. And when you give them praise, then they have a foundation of feeling like they can do it and have some autonomy. But if toddlers are discouraged or they can't do anything on their own, they may be discouraged, ashamed, or doubtful of their abilities. So for toddlers, it's about what can you allow them to do. So toddlers will want to be as independent as you'll let them to be. So it may be giving them some choices of where you do a blood pressure or a pulse oximeter. Do you want to hear or hear? Do you want me to do it or mommy to do it while I'm watching? Do you want to play on the floor? You know, what choices can we give a toddler and allowing them to have as much autonomy as they can while still protecting them. So toddlers are kind of like lemmings. So definitely keep a very close eye on them. Don't leave them unsupervised on a bed or in a crib. Toddlers can be very dangerous, but you know, what autonomy can you give them and how do we build rapport with them? Best advice for building rapport with a toddler is to learn the theme songs of their favorite shows. So a lot of toddlers do watch some TV. And so if you find the top 5 shows on Disney or PBS and can sing their theme songs, that will help you tremendously. I have teenagers and my daughter was asking me why I had CoComelon on my phone. It was because a toddler and I were watching CoComelon when her mom's phone died and I was getting ready to start an IV. So whatever it takes to build that rapport and to create that distraction and find some autonomy with a toddler. So if toddlers thing is I do it, preschoolers are definitely wanting to do things independently. So that independent initiative gives them a sense of purpose. But if we criticize or discourage them, they feel guilty. So for preschoolers, it's all about what can you allow them to do as part of their care. So a preschooler may take off a blood pressure cuff for you. They may put on a pulse ox. It's kind of hard to put on your own blood pressure cuff, but some of them manage it. Maybe they'll hold tape for you when you're taping an IV down. They may want to push their own IV pole with some help. Sometimes they're pushing too far down and it can fall over, so you may need to steady it too, but they may want to do that. They may want to take their medicine out of a cup. Definitely for both preschoolers and toddlers, positive reinforcement is the winner of the day. So sticker charts, especially for painful procedures like post-op TNAs that you need to get fluids or medications down, stickers for good job taking medicine, stickers for drinking a small amount of liquid. You could use just the medicine cups, half an ounce or an ounce at a time, and do a sticker for each one, and a certain number of stickers gets you a prize. Positive reinforcement will win your days with preschoolers and toddlers. So really think, what can you do positive? Kids that do well with positive reinforcement, I always tell the parents, go to the Dollar Tree and just buy it out. So making sure that you have some stuff that you can give away. We buy a lot of our supplies at the Dollar Tree just so that we have some stuff that we can give out to toddlers as rewards and preschoolers. Positive reinforcement, as much autonomy as you can give them, building rapport with them, singing songs, taking time, having fun. All those things will help you with preschoolers. The school-age kids can sometimes look like adults. When you get to be about 9, 10, 11, some of these kids are as big as an adult, but their stages are, they're still kids. So industry versus inferiority, kids are becoming aware of their individualities. So they see accomplishments and they want praise and support from those around them. And if they feel like they get that support and sense of accomplishment, they feel competent. And if they don't, then they may feel inferior or incompetent. So these kids also really want positive reinforcement. Sometimes they don't get it from their parents. Sometimes by the time they're school age, I'm seeing more divorced parents or split families, step siblings, things like that. So really making sure those school age kids still feel important, that you remember that they are still small kids, still growing and developing. They may still be afraid. They don't have a good context for how to put pain into life. So even though they may look like small adults, school age kids still need a lot of care, a lot of support, and are probably, because they have a little bit more context, are more afraid than sometimes the preschoolers are. So adolescence. So identity versus identity confusion. So I'm walking through this right now. I've got 2 teenagers. Wow, and the struggle is real. So they're trying to figure out who they are, and they're trying to establish their goals and priorities for their life, figuring out where they belong in the world. They're often overwhelmed by expectations and responsibilities, and they feel like they should have it all figured out, and they can't. So that leads to confusion about what their needs and goals are. So again, as we hit that adolescence, the 13 plus, these kids are, for all purposes, adults in terms of Roslow chart, they're adults in terms of vital signs, but they are still scared toddlers sometimes inside of them. There are lots of rules and regulations when it comes to adolescence in terms of privacy. So really being careful about what you ask a teenager in front of the parents. Some things can't be disclosed to parents, and you should leave some topics to the provider to discuss. So things like drugs and alcohol and pregnancy and STDs, don't touch those with a 10-foot pole. Those should be, those sort of answers should come from a provider, not from a nurse. I always wait to ask questions about alcohol and drugs and things like that until the parent has stepped out. I may suggest that they go down to the cafeteria and give them a gift card to the cafeteria to go pick something up if I want to have a private conversation with a teenager. So do be careful with adolescents and their rights to privacy. They are often very private and shy about their genitalia. You need to be sure that you're clear on your hospital's regulations about other teenagers spending the night. So generally speaking, an adolescent can have a parent or an adult with them, but not another child. So you can't have like 2 teenagers, boyfriend, girlfriend can't spend the night unless they're over 18. So really being clear about the boundaries, because a lot of them don't know. This is a new experience to them. So if you have a teenager in the hospital, you may need to be clear about what is and is not appropriate. your boyfriend can be here, but maybe not in the bed with you, or he'll have to go home at bedtime. But you will often have to be very clear about where those boundaries are. I have walked in on teenagers pretty close to having sex, so it is definitely worth having that conversation earlier rather than later, because it's very embarrassing. Young adulthood, I know that our PEDS unit often gets a lot of college students just because we're kind of the closest tier to that. So as you think about young adulthood, we're very much a college town where we are. So intimacy and isolation are the focus of the development, which begins at 19 and lasts till 40. So they're building upon relationships. Something to say about like college age students is that parents are often unaware of what happens when the kid turns 18, which is where they don't really have any rights to that information unless the child gives it to them. So making sure you're clear on the HIPAA regulations and have permission to let the parents know the child's here, or that what the child wants that person to know. Seems like appendicitis is huge in this age group. And so making sure you know before you send somebody down to surgery whether or not you can talk to their parents if their parents were to call, and let them know that they're here. So young adulthood, especially the early college years, have their own trials. A lot of it is very similar to teenagers, where they're super private. They're still trying to figure out who they are as adults. They haven't usually figured out all the social norms of being in a hospital. This is all very new to them.